Can you all hear me all right?
We can.
Wonderful.
All right. I want to welcome everybody to our January 5th regional report out for South Central Kansas. I'm John Rolfe. I chair these meetings, and we have a great group here today. To get to the point here, we'd love for you to sign up to get these emails or these reports emailed to you with the dashboard. You just sign up at covid.ks.gov/report-outs. That's with an S on the end. covid.ks.gov/report-outs. I think it'd be important to want to follow along here through the month of January. You can also email us questions or comments to ksregionalreport@gmail.com, ksregionalreport@gmail.com. Let me get started with the dashboard the Hospital Association puts together for us. I need Megan to make me the host here, and I'll put that up. There we go. All right. Okay, as you can see here, because of the holidays, some of the smaller hospitals had trouble getting the reporting in on time. You will see a significant drop on the staffing shortages. That has to do with the form that gets filled out federally on these, where that was defaulted to no issue. And so we're going to work on trying to get that more accurate here on future reports. I know it's been an area of focus for us. But, when we come down, I think a real focus here in the coming weeks is going to be around the percent of adult staffed ICU beds available in the region. Again, we're very near capacity here in South Central Kansas at 11% or 28 beds of the 256. And this is from yesterday. Again, a static number in time in a very dynamic and fluid environment. So it's probably changed today and throughout the day. I'll also just point out here, we're seeing this across the state where you had that dip in testing over the holidays. It was expected, normal, and then here's our bounce back the week after. So, you can see you really have to go back all the way to here to, several weeks to see as high a caseload numbers we saw in this region last week. And you can see it's a very busy season for hospitals anyway, even without COVID. And so you can see the census of the ICU beds and what's going on with the percentage of population across the South Central region here. All right. Now let me come on back. All right. I'm going to kick it over to Seth Conkle. Seth, if you just if everybody makes sure they introduce themselves. And Seth, if you can give us an update from the public health side.
Yeah, absolutely. My name's Seth Conkle, working kind of regionally on some public health issues and for the state of Kansas. So again, John, you kind of mentioned it. We saw that it was actually almost a 45% increase. So we're definitely going to the wrong direction, so to speak. Wanted to see that curve or that decline from the previous weeks. I kind of expected it as families got together for the holidays. Obviously, we're seeing some of those consequences now. I think the piece to keep in mind is that, if you're symptomatic, go get tested. Make sure that you can stop the spread by knowing your results. I think that's one of the things since the beginning of this that we've seen that results time turn around much faster. We're not talking in most cases 5 to 7 days anymore. We're talking 24 to 48 hours in a lot of cases. So I think definitely go get tested, then you can stop that spread. I think the other piece that we've been focused on in public health is vaccine. And we kind of mentioned it last week, and we're getting more and more people vaccinated throughout the state. And right now the focus is on healthcare associated workers. And that would be people like your hospitals. Long-term care facilities started this last week getting this out, their staff and their residents vaccinated. So that vaccine is continuing to roll out. It is obviously not going to be enough for everybody immediately. I think, again, the light at the end of the tunnel is that we have got less ahead of us than we do behind us. So we've got far more into this pandemic than we do have to get out of it. So it's coming. And as we have more information and more details about the vaccine and kind of where Kansans, and more specifically South Central Kansas, falls within that vaccine priority allocation, we will definitely be sharing that.
And Seth, can you share just a little bit about what you guys did in Trust Bank Arena? Were you guys were you part of that or?
Yeah, so here in Sedgwick County, anyway, they've kind of taken over one portion of the arena, and they're using it to vaccinate the healthcare associated workers. So those that don't have admitting privileges to the hospitals, doctors' offices, nurses, dentists, optometrists, all the people that fit into that healthcare associated group, they are using Trust Bank Arena to vaccinate anywhere from, I think they just upped the numbers to where they can do almost 1,500 or 1,800 people a day. So again, we've got to make sure that we have enough vaccine to do that. But I know Sedgwick County's got a good process in place to do that. And I think you're going to see that in all of your counties, that all of the local public health departments have responsibilities and requirements for years to plan for mass vaccinations. The mass testing piece, maybe not so much. But I mean, I think we're really getting into the core of what public health preparedness has been about for the last decade or so, and that is mass vaccination, mass dispensing. And so there are plans in place once that vaccine becomes available to make sure that it can get out the door in a rapid manner.
That's great to hear. And following the example, we were just on with KC Metro, and they were in the middle of a clinic where they're vaccinating 12 to 1,400 in a day, and that's encouraging. It is limited, as you said. I'll bring this point home by how much vaccine the state has. And I was on the phone with KDHE this morning, and it does seem to be clear that there's a software issue in our reporting up to the national level. That's why Kansas has looked so bad. Kansas actually did a good job pushing this through a hub and spoke model, one of the few states to get it out to all 105 counties, or all counties in the state. And it's even some of the big hospitals have had issues with the software that's used to report back up. But there's only so much of it, and very little communication about when the next round is going to come and how much will be there. But we appreciate folks like you, Seth, being available. And I do know, I think the state is preparing a website and some other ways to get information out to the public around the plan. And I'd expect that we might hear more this week around that. So Seth, thank you.
All right.
Anything you'd want to add?
No, I think thank you to this group, and thank you to those that are out there that are continuing to wear a mask, wash your hands, get tested, and follow those public health recommendations.
And Seth, let me just ask one question. So, we see that dip over Christmas and then it jumps. How many is that as people that would have been tested that Christmas week and then just went in the week after? Do you have a sense of that?
From a regional standpoint, I don't think we do. I think we definitely saw a dip in demand, and thus a dip in potentially a dip in positivity rate. I think that, again, families were social distance long enough and didn't do Thanksgiving and didn't do all the other holidays, and finally said, for Christmas, dang it, we're doing it. And not faulting anybody for that. My family did the same thing. We were all quarantined up until that point, but it's gotta. I think people are finally starting to find their way in what this new reality is. And so we're going to continue to see that until we can get people some immunity, and that's going to happen through vaccinations.
Great. Thank you, Seth. And I know you have to bounce, so we appreciate you being with us. Let me kick it over to Dee from Ascension Via Christi. And Dee, if you can give us a report from the hospital side and introduce our special guest too.
Thank you, John. I am Dee Jewell, and I serve as an outreach representative for Ascension Via Christi. I also support 9 critical access hospitals here in this region. And for the purposes of these report outs, I actually represent 31 hospitals across a 19 county area here. So, as it relates to the dashboard information, just a couple of quick notes to kind of add some context or add some meat behind that from a regional perspective. I know just here in the Wichita area, the Wichita hospitals, as we've seen, they continue to have a high ICU census as noted, and that's both COVID and non-COVID. And our COVID positive census in general is really still at a high mark. However, I would note that these numbers are not nearly as high as they were back when we really saw that spike in like mid-November, early mid-November. So, you know, it's still a high mark, but not as high as it was. And, you know, as we've stressed before, you know, the bed capacity numbers are very fluid. They change throughout the day regarding bed capacity and availability. And we have I would say we've seen a moderate increase in new cases probably over the past week, despite, you know, that kind of drop in what looks like lower testing rates. Now, that's from the Wichita perspective, but in the outlying areas and some of those that have reported to me from a regional perspective, they're seeing kind of either a plateau or a decline in COVID hospitalizations. Maybe they're still continuing to see an increase in positivity rates, maybe depending on how many people are testing in their areas or their communities, but they're not seeing as high of hospitalization. I know for a specific story from Hutchinson in Reno County there, where they were so high, they have seen a notable decline in their hospitalizations, and that makes them very happy. And of course, they continue to be, even their staffing is better. You don't have as many staff out with being ill as well. And, you know, Newton said to me that, you know, theirs is about the same. Their ICU beds are still at a premium. But everything else kind of is either about the same. Their staffing is okay, their supplies are okay, that sort of thing, and they continue the vaccination process. And I know Dr. Watson will speak to this in a few minutes, but of course the patient transfer challenges remain, as a lot of the outlying areas have challenges trying to, especially the Western Kansas, you know, having a hard time, you know, getting patients transferred to Wichita or other hospitals, and having to, of course, make several calls to several places, and that takes a lot of time. So that does continue to be a challenge. And, you know, as mentioned before, everybody's really going to be watching the numbers closely these next couple of weeks after the holidays, see what's going to happen. You know, could we get lucky and see what happened after Thanksgiving when we didn't see the big surge? You know, maybe we could get lucky in that, but we'll see. I have a feeling we're going to be seeing the increases. But and as it relates to the vaccinations that Seth mentioned, you know, that process continues in all the hospitals in the region. I know I can speak to Ascension just here in Wichita. We've given just over 3,600 vaccinations as of yesterday. And then I know that's rolling out, of course, in our Manhattan, Wamego, and Pittsburgh hospitals as well. I think overall, entirely in our Ascension facilities in Kansas, we've given almost 4,500 vaccinations. So we just continue to roll out that process, and hopefully get it expanded further and further as we go. I think that's about all I have for you, John. Do you have a question?
Yeah, just I was talking to you the other day, and Dr. Watson can speak to this, but on the transfer issue, there was a point where both major healthcare systems in Wichita were not taking new ICU patients yesterday. Is that right?
Yeah, that was the case, at least for part of the day. I'm not aware. I don't know for sure what happened later in the day, but I know earlier in the day that it was definitely, that was the situation.
Yeah, and I think we'll see. Dr. Watson's got a slide too to highlight that. But let's hear from the boots on the ground before we kick it over to him. You want to introduce our guest?
I'd like to introduce Whitney Rollman. She is the Director of Pharmacy at Pratt Regional Medical Center. And I was really excited that Whitney could join us today. I think it'll be kind of interesting to see that boots on the ground, kind of that experience from the pharmacy perspective. So Whitney, I'll turn it over to you.
Well, thank you. Like Dee Dee said, my name is Whitney Rollman, and I'm the Director of Pharmacy at Pratt Regional Medical Center. if you're not familiar with Pratt, we're about an hour and 20 minutes west of Wichita. PRMC is a rural community hospital. We have about 35 inpatient beds and 6 ICU beds. We also provide outpatient infusion services on our hospital campus. And we're in a similar boat to what Dee Dee said. It doesn't seem to be quite as bad as it was back in November when we had our really big surge. But we have seen a slight increase over the last week. So I'll kind of just talk about what my experience has been during this whole pandemic. It took a little while before it hit Pratt. We didn't really start seeing it a whole lot until October. It's definitely been a whirlwind of change, and it certainly feels like we're living history here. We've been evolving at a dizzying speed, and we've tackled so much new information, from new air cleaning systems, new PPE protocols, new medications, and new ways of monitoring patients' blood work, new vaccines. It's amazing, the evolution of knowledge and the new in this new disease has just been unprecedented. It's been a challenge, but we've tried to rise to the occasion as best we can. As a pharmacist, I deal mostly with medication management. As you know, there's been quite a few new medications that the FDA has authorized for emergency use. For our facility, we started using remdesivir once it was available for inpatients. And we also have the monoclonal antibodies, the bamlanivimab, and then the Regeneron cocktail, the casirivimab and imdevimab. And those are both outpatient infusions. But getting those items approved, having them built in our system, having a plan for how we would administer them and how we would make sure people met criteria, figuring out what we would do if there was an adverse reaction, and educating all of our staff members were all tasks that we completed at record speed. We're very thankful to have those therapies, but it's kind of difficult to roll all those new things out when your staff is shorthanded as it is. So I'm very proud of what we've been able to accomplish in a short amount of time. And these infusions are, an hour-long infusion and an hour-long monitoring. And we've just done about 90 doses and here since we got them back I believe it was the end of October, beginning of November, and our providers are starting to feel pretty strongly about having those monoclonal antibodies available. We've seen some really good results, and patients have been reporting that they've been doing really well after about 48 hours. They've been saying there's a noticeable difference, and so time will tell once more data is available, but that's really encouraging to have that therapy as an option.
Is it important to catch people early in that?
Yeah. So those outpatient infusions, there's a certain set of criteria that the FDA requires us to use. So they only approve it if you meet a certain criteria. So if it's only for patients outpatient before they're on oxygen therapy, and it's actually been shown to possibly worsen patients who are more progressed in their treatment. And I think a lot of these medications, the way that they work is going to be optimized by when they're administered. So some medications you want to administer early on, whereas others like steroids are definitely shown to be beneficial once they're farther along. So depending on the point a patient is in their disease state depends on what medications our providers are picking for them. We have lots of medications that we had used that were already in our artillery: steroids, anticoagulants, vitamins, and other treatments that we've utilized. We've also had to deal with drug shortages. Has been a big part of what we've always done, but even more so now during a pandemic, dealing with those allocations, reaching out when we can't get something from our wholesaler, calling around and trying to get it through other avenues. That's been a lot of what's kind of sucked up some time in pharmacy. These patients are critical, and they're in the ICU, and they're requiring much higher doses of some of these sedatives. So, we've had to get creative some of the times when we started needing to conserve what we had. We've been lucky we haven't encountered any dire situations this far, but I mean, like many other hospitals, we've definitely had to get creative with conserving what we have. Which takes time when you've got staff that's already stretched thin. Another area that staff's really stepped up is in vaccine organization and administration within our facility. It was really a hopeful and exciting day whenever those first vaccines arrived here. So far to date, we have about 230 of our 400-person staff that have received their first dose, and we really look forward to being able to roll that out to our patients when we can. But I think, like what Dee Dee said, our staff sickness has improved since November, certainly. So that's whether that's vaccine related or not, it's hard to say, but either way, it's encouraging that we're not having as many staffing shortages. We're not having to go on diversion just because of staff that's sick. As far as staffing goes, I mean, just communication in general when things are changing so rapidly is difficult, but even just communicating with nursing staff who's in a room where they've had to garb up, they've got extra duties that they didn't have before. So they're now expected to clean the room daily or to draw lab work and to do all these additional tasks that they haven't had to do. So it's just taking a lot more time, and communicating has proven to be an issue. Even if you're right outside the room, it's hard with you when you've got all your gear and they've got their respirators. It's hard to communicate that. And even when we've got codes and a patient in a critical situation, making sure that we're communicating everything and that you can hear through those masks, it's really difficult to do. And even monitoring everything, it's proven some obstacles we've been able to work with so far. But even though there's maybe fewer patients at times, like right now, there's fewer patients than we've had in the past, but they're still taking a lot of time just because of the amount of effort that has to go into all of this. And then the difficulty with not having their families and their loved ones. A lot of times family and loved ones can help with some of those little things that they can't help with now. So that's difficult. We did just open up to allowing one visitor per patient, but that's not for the COVID patients. So, I mean, being in a rural hospital, we don't have a lot of extra staff, and the staff we do have wears a lot of hats. So that's probably been one of the most challenging pieces, in addition to just all the evolving information. Transferring patients and codes, like you said, there for a while, we had patients that would sit in our ER for a while just because we couldn't find a bed. We've seen that alleviate some, and I hope that remains. But it's hard. I mean, overall, it's just hard to see patients suffer mentally, emotionally. It's draining, and there's a lot of them doing a lot worse. And in a rural community, when you have a lot of the nursing staff may know some of these patients personally, even before this. And so I feel like it kind of adds an extra layer of emotional drainage, I guess. And it's hard. You don't really know which way patients will go. We've had some that have started doing poorly and struggled, and they didn't make it. And then we have those days where they do make it, and it's really exciting, but there's times where you don't think they will. We had a patient last week in his mid-40s that was on a ventilator for 16 days. And I think they had multiple conversations about he may not make it, it's not looking good. So when we were able to take him off that ventilator, it was very exciting because there's been so many times where we haven't been able to get them off that ventilator. And our ICU nurse had even said to his sister, we need him to be our miracle. And we certainly felt that way whenever we were able to extubate him.
Go ahead. I'm going to have to ask you, it's a great report out. I may just need to ask you to wrap it up here in the next minute or two.
No, that's it. And just the doctors at our rural facility also tend to know these patients for a long time before and then treat them in the hospital. So yeah, that pretty much wraps it up for me. Thank you for inviting me to speak today.
Whitney, you're great. It's really good boots on the ground report and giving us a picture of what's going on in the rural hospital world. And thank you for your service to the people in Pratt and to Kansas. So we're grateful for you. Dee Dee, anything you want to add before I kick it to Dr. Watson?
No, that was wonderful. Thank you so much, Whitney.
Dr. Watson, can you tell us a little bit about the transfer situation?
Yeah, interesting. And I'll show this just because it helps understand how critical it is. This is the traditional receiving hospitals that we monitor in the state. And this is where we are right now, essentially. And Dee Dee's right, this changes all the time. And it's not necessarily reflective of exactly how many beds are available at any one facility, but it does speak to the fact that we are tight here. And we use broad brushstrokes to look at this, just trying to understand how much difficulty there is. I think in the current region we're in, the story is one of about the same by the numbers. The acuity is about the same. The percentage of COVID are about the same, maybe a little less. The number of people asking us to find beds are about the same. But what we're seeing are two separate groups. We're seeing a group that is sicker and demanding higher levels of care that are much more difficult to place. And then we're seeing the less sick who are able to stay closer to home or not to move up to the tertiary quaternary care centers. And what that does is that it allows the system to have a little bit of flex at a regional level, but realizing the tertiary quaternary care centers are really strapped right now for what's happening. So hopefully that as this plays out a little bit, that we'll stay at a plateau. I hope we don't go back to another spike like we did in mid-November. These next 2 weeks certainly telling for the state.
Well, thank you very much. Yeah, bottom line or headline there, I guess, being that if it's a more acute patient and they're in Pratt, it's taking longer to find them a place. And if it's, fortunately right now, if it's not as acute, it's a little easier to find a bed than what it would have been a week or two ago.
Yeah, and hospitals are able to hold on to them as opposed to necessarily just having to find someplace because they have no beds. I think that's what we're seeing. So.
And so this has been the January 5th regional report out call. Quick, love bright spots. I'll just do this one. This came from Dee Dee. Just thought it was great. You got to find ways to memorialize and celebrate these heroic stories. Via Christie put together a book that they put, to all their team members out there, just walking through the journey they've been on so far with pictures and stories and all that. And just a great human moment here to recognize what I think Whitney said, and I wrote it down, we're living history here. And that's so true. And so it's just great to see a group take the time to memorialize some of it and share it as we're still in the midst of it. I just want to encourage everybody, Dee Dee or Whitney or Dr. Watts, anybody have anything to add before I wrap it up? Okay. Thank you all for your time. We'll be here at 1:30 every Tuesday live on YouTube, but you can sign up via email to get this and the dashboard sent to you. Go to covid.ks.gov/report-outs. I think it'd be important to follow along this month as some of the leading indicators are showing that we're really going to need to watch hospital capacity and how that might clog up the system and begin to create issues. So we'll be watching it closely. Thank you everybody for being on here, and we'll see you this time next week, and Happy New Year to all of you.